welcome back to our show. We're joined in our booth with Kelly Dawes. Thanks for coming down.
Well, you're welcome.
Kelly lives in Kentucky, and she commutes 80 miles into Tennessee one way to teach patients about diabetes education.
That's
and
right.
I'm just thanking you right now for that, because that's a huge thing.
Well, thank you.
What is your practice like? What's your specialty?
Well, I work in a hospital setting, so we offer a class, all-day class, plus I see individuals one-on-one, and then I see patients in the hospital, inpatients.
So you go like bed to bed?
Right,
okay.
right. And then I might get called down to the ER, to the emergency room, to see patients. So it's kind of...
What do? You walk in the room, and maybe you test their blood sugar first off, or see what the readings are?
Yes. We always try to give them a meter, a blood sugar meter, so that they can check their blood sugar on a routine basis.
Themselves?
That's right.
That's empowering.
That's right. So whether they come to our class or individual, or I see them in the emergency room or in their patient's room, we always give them a meter.
Okay. And what kind of issues come up when seeing patients in the hospital?
Diet. What can I not eat? What are you going to take away from me? So diet is always the main question. What can I eat? What can I not eat?
In that setting, do you work with the hospital food planners to?
We have dietitians, outpatient dietitians. We also have inpatient dietitians. So I work closely with dietitians.
And you could probably see if they get the wrong food, their blood sugar is just going to go right through the roof.
That's right. It's really good if I can go in the room after they've had their meal and we check their blood sugar. Plus I can ask them, show me on your tray, what are the carbohydrates? What's a protein? What's a true vegetable? So they've got, you know, the model of what they just ate or eating as I walk in the room. So they've got a good food model right there in front of them. And they can see the portion size.
Right. And I think so many of us take it for a given that people know what's a protein, what's a carbohydrate, and I guess a lot of people still need educated.
That's right. Or what's a true vegetable versus a starch. Of course, you know, living in the South, everybody thinks that corn, potatoes, that's a vegetable, which it is, but it's not a true vegetable. It's a starch. So, but living in the South,
that's interesting. Yeah.
We have a lot of the beans, the macaroni and cheese, the corn, the peas.
Yeah. Yeah. So is obesity an issue?
Yes, and especially in our younger generation. I had an inpatient whose son is below the age of 10, and he's already what we call pre-diabetes. Below the age of 10 and already pre-diabetes.
It's kind of scary.
That is very scary. In fact, we've seen 13-year-olds, 15-year-olds, 17-year-olds, not with type 1, but type 2.
And what do you do for them? Start with the nutritional counseling?
Try that, and we want to get the whole family involved. Get the whole family involved. We don't want that child singled out, thinking that they're been bad or they haven't been good. So
with them,
right. So we want to get the whole family involved as far as with diet and exercise.
So you go into the hospital, and you say, do you work in the clinic as well?
Well, we don't really have a clinic per se. I get referrals from doctors, and then they come to our class, or we see them one-on-one, individual. So I don't go to a doctor's office. The patients will come to the hospital for their class or for the individual, the one-on-one.
How big are your classes?
Well, we keep class kind of small so that they can always get their questions answered, especially because they're going to spend time with the dietitian. So we see anywhere from 3 to 6 patients, plus they can bring family.
Okay.
A family member. But we keep class kind of small so that it's informal, and that way they can ask plenty of questions, especially for the dietitian, because that might be their only chance that they're going to meet with the registered dietitian. So we want to give them as much chance as possible to spend with that dietitian.
Yeah.
Whether it's class or even individuals, what we call the one-on-one patients. We want to give them as much chance as possible to see that dietitian. We've also do a pre-diabetes class.
Really?
So remember that child I said that was less than 10? He's actually what we call pre-diabetes. Pre-diabetes. So we've started offering about a year ago a pre-diabetes class.
And is that you teach the same things in the pre-diabetes class?
We don't go over meters and we don't go over medications, but it's lifestyle changes.
Okay.
Lifestyle changes. We talk more about exercise and the risk factors, you know, as far as the risk factors for getting type 2 diabetes and preventing type 2 diabetes. So we talk about exercise, lifestyle changes, and then again they spend time with the dietitian. We just had our pre-diabetes class last Thursday before I headed out to come to St. Louis.
Is there anything that's kind of a little trick or tip that you do that works well with patients you could share?
I think not being able to relate to patients, as far as being, what am I trying to say? As far as not, I can't believe you eat that.
Right.
I can't believe you don't exercise.
That probably wouldn't work out so well.
Right.
Yeah.
So it's trying to relate to patients and saying, hey, I do that. You know, I do this. I do that too. You know, that's human nature.
So listening probably is
right.
It's really key.
Right, and not being a bully, and you know, just trying to be there for them.
Yeah.
And a lot of patients they want to talk.
Yeah.
You know, and of course stress raises blood sugar. So if they have a stressful home life, you know, we try to help them with that. You know, try to take a step. And I tell them it's easy for me to say, you know, get away from that stress, but at least maybe just take a step back, try to get out and take a walk, read a book. But don't read a book and eat. You know, don't watch TV, you know, watch your favorite program and eat. So try to do things that don't trigger eating. So.
Has there been anything at the show this week that maybe you think educators that couldn't come should know about?
This is my first year in coming.
Oh yeah? Congratulations.
Thank you. So I think everybody should come at least one time.
Yeah.
And just see it all and experience it all.
Well, Kelly, it's been great to have you come down to the show.
Well, thank you, Scott.
And keep up that good work.
Okay.
And I hope that commute doesn't get to you.
Well, so far it hadn't. I've been doing it for 6 years, so.
Okay, well then you're good.
It gives me a chance to think, oh yeah, I need to do this, I need to do that, I need to do this. Just don't tell my hubby I make little notes.
While you're driving?
As I'm driving.
You should get like a dictaphone.
Yeah, that's what I need, a little recorder.
All right, Kelly, thanks for coming down.
Well, thank you, Scott.